السلام عليكم ورحمة الله تعالى وبركاته. Thank you very much, really, Mr. Vice Dean and Dr. Kumar, the coordinator, and all of you for inviting me to participate in your important, which I understand, college seminar series. This is, I understand from Dr. Kumar, it's really an important activity. Really, I'm happy to know that you are conducting this series of workshops. In fact, when Dr. Kumar contacted me first, we were discussing to talk on how to construct better quality MCQs. But then after some discussion with him, I suggested that it is better to narrow the topic to focus on an important aspect of this big theme of constructing better quality MCQs. In fact, to construct better quality MCQs, it is a big topic which needs some hands-on training, and it needs to use some application of the knowledge on how to construct. So it's really, I thought maybe it is not very suitable to give just an overview, theoretical, on this important topic in 40 minutes or so. So then I suggested it is better to focus on something which maybe will be useful of both of us, which is these technical item flaws common to multiple choice questions. And in fact, I know, I am fully aware that you are very much experienced in MCQs in exams for a long time. And your experience is very well appreciated and acknowledged, for sure. And this talk is actually, it is not one direction, it is two directions actually. Really, I know I am going to benefit a lot from any comments or maybe any questions or any discussions that you would make on this important subject. So please, I invite all of you, you share your experience with me. I am sure I am going to benefit more from you. I am one, you are all with this huge experience in multiple choice questions for a long time. I am sure I will benefit a lot from your discussion. So, hopefully, at the end of this presentation of this session, we are going to, I hope, you'll be able to identify these flaws which are common to MCQs. Sorry. And probably also to recognize the importance of good quality MCQs, and of course, on the other hand, to recognize what is bad about item flaws. Let us look at least for this presentation, to MCQs in the perspective of measurement. We'll take this as measurement because this will be very useful for the discussion. Of course, it is more than measurement, but let us concentrate on this perspective. So, since it is measurement, then it is expected that if you are measuring something, it is made an instrument. You want to measure something, like measuring the height and weight of this boy by this important instrument. But for any measurement, you need instrument, yes, true, but you need this instrument to be valid instrument. Otherwise, There is no purpose of doing with any measurement with your instrument. So it should be valid and fit for the purpose which is made for. Like a test of MCQs, you want to measure the learning objectives, so it should be suitable exactly for that purpose to be valid. And it should be, of course, reliable, consistent. Like the weighing machine for that boy, if we weigh and measure the height of that boy many times during the day, it will be the same. If we use it for another boy having the same height and weight, it will give the same. But the problem, of course, is not only having MCQs or tests. Let us first consider, you want to decide at the end, actually, you want to decide on pass or fail. You want to take a decision to certify your students. You want to license them. You want to license them that they are competent in whatever subject you are doing the measurement or test. So the decision, it is not an MCQ only. It is a decision on which is very important decision. This decision you are using assessment, but in your assessment you are using these items, MCQs. So it is really more than an MCQ. Let us just have maybe just one slide or two slides about the criteria of good quality exams. One of these is that the quality of MCQs and the language should be of high quality, let us say. The other important criteria is the performance of your items, your questions, MCQs or whatever it might be, and the performance of the examinees, of the candidates. This is also very important, and this is usually is indicated by the item analysis after you do your MCQs exam. And the third one is the consistency of your scoring system. You have to have a consistent scoring system for the MCQs. This is no problem because this is very consistent. The mark is automatic and the analysis will be given automatic by using the different softwares. So for this one, it is not a big problem. But for the other two ones, maybe comes the problem. Now let us focus more on the quality of MCQs. These should be consistently presented. That means you have to use a format, you have to agree on a format with its full details on how to present this, your MCQs to your candidates. And this should be used by all the departments in all their tests. This is found to be very important for the examinees. And the other, of course, important things you know, you have to align your questions with the learning outcomes of your course. And the third one, you should care very much. You should take care of technical item flows. Let us now focus on item flows. What do we mean by item flows? You all know. The flawed items are confusing or contains ambiguous material or complicated and not clear. Or also may contain some clues for the correct answer, and this will spoil your instrument. So let us think of flawed items, high prevalently occurring in your MCQs, I hope not. You will come up with a test which is flawed test. What is bad about this? What is the effect of this? The effect of this is very serious. This is proved actually. It will negatively impact the pass rate of your students. And so your final decision will be invalid decision. Your final decision on pass or fail will be invalid decision. Flawed item found to be failing 1/4 of students than non-flawed items. That means if you have, say, 100 students in your class, and for that class you have 25 failures, suppose, or let it be 28 for the calculation. These 28 failed. You expect if your exam contains a number of flawed items, 7 of these students of the 28 fail for the reason of flawed items, not because they are bad students, because your questions are bad. It's a serious issue. And maybe for some of you it will be surprising if you know that actually it is found that over half of MCQs used for high stakes exams, even for finals, are actually flawed items. So actually it is highly prevalent, these item flaws. All of us, we commit this in some way or another, but I hope not too much. Now let us talk about exactly some flaws. These flaws, usually they are divided by some authorities in medical education into 2 big categories. The first category is that issues related to the test wiseness examinees. These are experienced examinees. They know how to answer MCQs, even if they don't know the real answer. So there are some issues, some flaws, directed to the key answers without them knowing the real answer. This is a very serious issue. And some of the flaws actually related to irrelevant difficulty of the items. That means they make your item difficult because they are flawed. But the item is not actually difficult. So this will affect, of course, the performance of the examinees. Let us take some examples to illustrate as much as we can of these item flaws. What do you think about this step of this question? Which one of the following group of drugs is preferred in a hypertensive patient with diabetes mellitus? It's a clear step. Although which of the following is not preferred and is not advised to use? It is very commonly used, but it's not preferred. And let us see the options. Actually, without seeing the options, the rule is to be able to answer the question without even seeing the options. The candidate, the examinee, should think of the answer for this question, if your question is answerable. So you should pose unanswerable questions before the student look to the options. Unfortunately for this one, this is not applicable, because starting from the fair is the wrong way. Which one of the following? That means you have to look to the following. But actually, it is not advised to put it in this way. Looking at the options. Yes, what do you think of these options? Have a quick look at these options. Well, you discover anything? Any problem in the options?
Yes.
Very good. Very good. So B and D actually are talking of the same thing. And you ask your candidate to give the best answer. So by logic, B and D are excluded already. Even if he doesn't know what do you mean by what you are saying. Even if he doesn't know the answer. They will exclude these two. So they are remaining with A and D, A and C. So they will choose from A and C. So in this case, you change your question from 4-option question to 2-option questions, which is true-false question. And you know what is bad about true and false questions? 50% chance to answer the question without knowing the real answer. 50% chance. So at the end, you will get with a score where you don't know if your students really they know or they don't know. Because 50% of chance, they don't know. 50% of the chance. So this is logical cue or clues and the items is a very common item flow. Take this example. Epinephrine causes which one of the following effects on systolic blood pressure? Again, which of the following? Not advised at all. Again, you cannot answer the question if you cover the options. You are not following the rules. But also look at the options. What is the problem in these options? Yes?
D and E are not.
Yeah. D and A are just put as fillers. They want to fill the 5-option format only. But the 3 ones, A, B, C, and D, they exhaust all the possibilities. It's either increase, decrease, or remain the same. No other possibility. But you find these questions in MCQs. You find them actually in exams, sometimes in even high stakes exams. So like this, by logic, again, from 5 options, 2 are excluded by the students who don't know. So they will choose only from 3. Look at this example. Local anesthetics are most effective in the A, anionic form acting from inside the nerve membrane, cationic form acting from inside. So our colleague here is playing with these two. Yeah, is playing with anionic, cationic, uncharged. I'm playing also with the acting from inside, acting from outside. You know what the students who don't know how they solve this question? They are very much experienced, but they don't know the correct answer. But they can answer. They can, by exclusion, come to the correct answer. They are very smart in this. They look to the option which contains all those which are common to the other options. Like this. Subtracting. They will reach the correct answer like this. So, for example, anionic comes only 1 time. They will come to the answer. This is not the correct answer. Cationic coming 2 times. Maybe it is possible. Uncharged, no, these are not possible because anionic, cationic, these are charged. So maybe these ones they will not consider. Then they come to inside, outside. They will say, okay, outside, inside, outside, inside is more. And these 2 are already excluded. So they will think of these 3, and then they will think of the 2 common inside. So maybe they will take these 2 ones as, then they will come to the answer like this. Again, they will come with 2 options only, which is true, false, and at the end they will answer the question. And you think that you are measuring their learning, but you are not actually measuring their learning.